For many years, India's medical interns have been fighting a silent battle. A battle not for grades, not for postings, but for fair pay. Because while interns in government medical colleges get around 20,000 to 30,000 per month, their friends in private colleges working the same shifts, doing the same rounds, often get paid half of that amount, or in many cases, nothing at all. Yes, no stipend, even after working 12 hours a day, handling patients and taking equal responsibility inside hospitals. और अब लगता है कि finally system ने ये आवाज सुन ली है. The Ministry of Health has directed the National Medical Commission (NMC) to review and fix this long pending issue, and that's a good news. To make sure that all medical interns, whether from government or private colleges, get the same stipend. Let's go back a bit. In 2021, NMC introduced the compulsory rotating medical internship (CRMI) regulations. It clearly said all interns shall be paid stipend as fixed by the appropriate authority applicable to the institution or state. Sounds okay, right? This line gave each state or university the power to decide the stipend amount, and that's how the disparity started. So while one state paid 30,000, another paid 10,000, and some private colleges didn't pay anything. Then came PGMER 2023, the Postgraduate Medical Education Regulation, and this one said something totally different. All interns shall receive the same stipend irrespective of the type of institution. Now you had two official NMC regulations contradicting each other, one allowing different stipends and the other demanding equal pay. ये तो confusion था. The confusion led to the massive frustration among interns, especially those in private colleges who worked equally hard but felt completely undervalued. Imagine this, you and your batchmate both wearing the same white coat, doing night duties, managing patients in the same hospital system, but at the end of the month, only one of you gets paid fairly. कोई भी system में ये injustice नहीं होना चाहिए. But for years, this was the reality for thousands of medical interns across India. Finally, after 3 years of continuous pressure and public demand, the Health Ministry has intervened. This means NMC has officially been asked to review and amend the CRMI Regulation 2021 to ensure the stipend parity across all institutions. Resident Doctors Association like FIMA and FODA have long demanded the same. They have held protests, released statements, and kept reminding the authorities that equal work deserves equal pay. With this directive from the Health Ministry, there is now renewed hope among thousands of interns across India. अच्छी news है that maybe after all these years, their efforts will finally be valued equally. But let's be clear, this is not the final implementation yet. The Health Ministry has asked NMC to examine and amend. So the next big step is for the NMC to officially change the CRMI regulations and enforce the rule of equal stipend for all. तब ये victory complete होगी. Equal pay for equal work. It's not just a slogan, it's basic fairness. Whether you are in a government college or a private one, your white coat represents the same dedication, the same sleepless nights, the same service to patients. This directive is more than just policy change, it's a sign that your voice matters. To all medical interns watching this, keep raising your voice because change begins when you refuse to stay silent.